The symptoms develop and they tend to progressively get worse to the point where the person is motivated to contact their family doctor. Mm-hmm. Most of the time, that's the person who labels this condition or these symptoms and says, "Sir or ma'am, it appears that you have peripheral neuropathy." Well, at that moment, that patient is expecting some help with that problem. But I have yet to meet my first person, the first patient that has ever said to me, "My doctor helped or cured my neuropathy."
Interesting. So is this because of a lack of knowledge, a lack of experience, or why is that?
It's more because of the nature of the condition. The condition is not correctable with a pill or some procedure. Okay. You have to address all of the causative factors, and there are several, such as we need to enhance blood flow into the feet. I teach that in segment number 1, chapter 1 of my course. We need to find places in our anatomy, such as the lower back, where the nerve signal gets disrupted and it does not transmit in a healthy fashion back to the brain. So the brain interprets the symptom, the nerve signal that is, incorrectly. And so I'm going to talk about that in the course and show people a couple of simple ways they can address that problem. It's very, very effective. Now, in the process of all of these things happening, the nerve form itself becomes aberrated. That's a word we use for meaning abnormal. It changes its shape, and therefore it has a different effect. It's kind of like when you get an electrocardiogram done at your cardiologist's office. He can look at that little tape and just instantly, because of his training and experience, he can see the shape of that neurologic, or I should say electronic waveform, and he knows if your heart is healthy or if it's not, and sometimes what's wrong with it just by looking at that. And these nerves, these sensory nerves, have their own waveform. That changes to a pathological, abnormal shape, and it creates these symptoms that we have been talking about. So in chapter 3, step 3 in the book, we're going to show people procedures, some things they can do to actually correct the waveform. That's an exciting part of the program. Chapter 4, we talk about ways to enhance the nerve transmission to where the degenerated, unhealthy nerve becomes actually healthier. I sometimes use the example of a section of your lawn where the irrigation water doesn't get, the sprinkler system goes bad and the lawn turns brown. Well, the lawn is not actually dead. If you restore the water to the lawn, in a few days it starts to look green again. And we can do some things with these sensory nerves where we can make them healthier by giving them some stuff that will help regenerate them. Now, this is a good point, a good place to repeat. There is no one single thing in neuropathy case management that will fix it. There are clinics around the country, and we love them. We're really happy there's doctors out there trying to help, and they do good work. But they, as a general rule, they tend to focus on one or two things that they've found that helps neuropathy. And as a result, 2 or 3 of the other main components get neglected, overlooked, never get addressed. So as a result, they will indeed help a given percentage of their patients. But a larger percentage of their patients will not get better because 2 or 3 or 4 things that needed to be done never were addressed. So I want people watching our interview to understand this is a broad problem. It has many components. Your physician, your family doctor, cannot and will not take the time that it takes to sit down with you, the neuropathy patient, and train you for an hour and 15 minutes. It's just not the way that medical practice runs. However, on the video program that has been created for this, that's exactly what I do. I take sufficient time to explain each step and have pictures and demonstrations to show people what they need to do and how to do it. And the nice thing about having a DVD or a download on this is you can watch it a second and third time. When you leave the doctor's office, oftentimes you go home and your wife said, well, what are you supposed to do? And you say, I forgot. That happens. That happens. That's the value of having this in an electronic format where you can watch it over and over. Or you can watch one segment and stop it and review it and just do that, then move on to the next one. It's the perfect tool for the person sitting at home to fix their problem. Because they can't be flying off to a distant clinic and spending thousands of dollars for air travel and hotels and doctor bills, and then just get one or two things addressed with their problem. I want to see that the neuropathy patient gets everything that relates to their case as much as possible. And it's some things that they can do in their own home to restore the conditions that will help those nerves get back to a healthier status. And as that happens, then the symptoms we've been talking about earlier either go away or they reduce in intensity to the point where the patient is very happy with their status.
Dr. LABRUM'S 5-step neuropathy treatment program is now available on video. No need for expensive clinics or doctors. You can follow his unique treatment program in the comfort of your own home. Dr. LABRUM carefully explains the how and why of every step, so the entire program is easy to understand and follow. And you can benefit from this economic and effective neuropathy solution derived from decades of clinical experience. Visit myneuropathygone.com to learn more.